Vince Todd and I and Gary Adamkowitz and Ann Backus helped organize this session. This is actually the second in a three-part series that we've organized to try to look at creative resources and strategies for community-based research, research translation, and science communication. And we have a series of speakers today that'll address that goal through various examples of work they're doing and resources that they have through Harvard that some of us could potentially use for community-based research, research translation, and/or science communication. Our first two speakers are from Sea Change, the Harvard Chan Center for Climate, Health, and the Global Environment. And Ari Bernstein's gonna kick us off. He's the director of Sea Change and a pediatrician, and he has an illustrious resume of activities that he's been involved in around climate change research and communication with a wide range of stakeholders, including press, industry, parent groups, pediatricians, the Climate Channel, Congress. And I think his research focus has really been very broad in terms of thinking about human health impacts of climate as well as other global changes on both pediatric clinical practice as well as population-based health metrics. And I think Ari very generously offered to give us a nice overview of the context in which research translation has changed in recent times, especially in light of COVID and health disparities highlighted by COVID, and how to think about public health messaging going forward, including public health messaging that's inclusive and does not leave out groups of or communities or interests that have a particular stake in a particular public health issue. So Ari, thank you so much for joining us. I know your time is tight, so we're really looking forward to your comments and helping us sort of set the stage for thinking about the research communication translation part of this session.
Thank you, Susan. I'm really honored to have the chance to be with you all. It's nice to see some familiar faces, and there's a lot of new faces here. And I would wish we were in person so I could have the chance to shake your hand or whatever we're allowed to do these days. I will take a few minutes here to give some reflections on how I've seen the terrain really shift on what effective translation and dissemination of public health science looks like over the last several years. Our work has focused particularly in climate, which, as you all know, is a very political arena. And the pandemic, I think, really accentuated and accelerated the transition landscape. When I started at Harvard, the best and highest research translation that typically happened was a research study was put out and there was a press release, and that went out on a newswire. And it may or may not have been picked up by certain media outlets. That was more or less the standard. And up until social media got picked up by the school and other schools, and that happened maybe 5 years ago. But it was always tweeted from, or put on a Facebook post of the school or the researcher. And it turns out that, at least in my view, COVID showed that really doesn't work very well. And that this is probably not news to you. One of the positions that I've been fortunate to have in the past year or two is working with an organization called Pattern. Pattern is the Weather Channel's climate outlet. So they now have a specific channel focused on climate. And when they started it, it was a social media only enterprise. Some of you may know the Weather Channel is it is the most downloaded app on people's phones in the country. It has relatively equal distribution between people who identify as Democrats and Republicans. And it crosses across racial and ethnic lines, and with some of their material actually age groups as well. And we were talking about this issue of dissemination of scientific research. They said, we essentially use social media platforms as our way to engage with key audiences, but we try not to do it ourselves. We try to find folks that we can partner with who are already trusted communicators in those communities. And I said, well, that makes a lot of sense. And in a minute, I'll turn it over to Liz to talk about one of the initiatives that we started at Sea Change that I think reflects that mentality. But one of the reasons that it's so difficult to get what we do out into the real world is because there is so much noise, number one. And number two, when credible information is sought, people don't look to us. They're not Googling us. They're not hitting our Twitter feeds. But there are ones that they do Google and that they do have as, follow on Twitter and TikTok and wherever else. So I think that's a key shift in approach. And I think that the other piece that the pandemic made clear is that we often have been on the defensive in communications, right? So something changes in the world, and then we try and message out our research about it. Like the pandemic is a very good example. And obviously it's important to be there when the knowledge is needed. But at the same time, and this is research out of my day job, which is pediatrics, the vaccine refusal work has taught us a lot about how to address misinformation. And in a fit of, I guess, irony, one of the best ways that has been found in that world is to inoculate against misinformation, meaning that the best way to prevent people from making arguably bad decisions about vaccination is to get them before the misinformation, get the good information to them before the bad information gets to them. So what does that mean for public health science? It means rather than doing an ad hoc approach to communication, it means having a steady stream of communication about important science that matters to people where they are through channels that they are trusted with, right? It is not adequate to simply put out notices when research comes out. You have, like a good example in the climate world is I had a paper on heat that was published in November. It's not the press release on that ain't gonna help people. The time that people need to know about that is like now, right? So the challenge is, our typical approach clearly only gets to a very limited subset of people, most of whom are very well informed already. And we really need to rethink our approach to getting information out and the channels that work in that way, and establishing audiences in many cases through partnerships that are not traditional for academic institutions. The last thing I'll say, and this is another thing I've learned both in work with the Weather Channel and also to an extent with Netflix now. The demise of local media has really, I think, hindered a diversity of views in traditional media, right? So local newspapers are more or less dead. If there are local newspapers, they're owned by mass conglomerates. But at the same time, in the wake of that demise has been an upsurge in minority-led media efforts, typically on social media, though increasingly in more traditional news outlets. And those groups absolutely are doing really important work at disseminating information to their communities, but they don't look at Harvard's press releases. So again, the people who tend to get our press releases are the mass media, typically more affluent, typically more white, and the challenge is the approach to the others we still are figuring out, and largely because we haven't formed those relationships as well as we might. But in fairness, no one in public health has, at least at a school level. But I think that's where we need to increasingly look is where are these media outlets typically run by people of color in places that wouldn't necessarily look to us that we can reach out to and form partnerships with. So those are just a few thoughts. This is something we work at Sea Change on all the time, and I would argue that in every circumstance I can think of, the best thoughts that come out in this regard are Liz's, and I want to now turn it over to her to tell you about the example I mentioned related to how she came up with, I think, is a brilliant way of doing this, not, both finding new ways to disseminate knowledge, elevating some voices that we really thought needed to be elevated in the climate world, and again, potentially creating channels for inoculation, knowledge inoculation. So Liz.
Yeah,
let me just briefly, Liz, I didn't mean to neglect you. I just wanted to give the audience a little bit of your background, if that's okay.
Sure.
So, so Liz manages communication planning and media relations for Sea Change. And she was previously the head of communications and the national spokesperson for the US EPA, and has also held a position as the deputy press secretary for Secretary Tom Vislak when he was the secretary of the Department of Agriculture under Obama. I guess he's now been reappointed under Biden. So she's had a lot of experience thinking about communications on a national level and communications around a wide range of public health related issues and information. And so I think I'm really looking forward to you giving us some specific examples of the general principles that Ari outlined. So thanks so much for joining us.
Yeah, of course. Thanks for having me. Yeah, so my background is in government, politics, and public relations. I didn't come from the public health field, but so much of, I think, what I learned working on campaigns and politics, really applies to public health, especially as what we've seen with COVID. So I'm just going to talk a little bit about what we do in terms of our communications at Sea Change and some of the projects that we've worked on recently that may be of interest as you think about how you're going to communicate new research. And really, I think the point that Ari was getting at is that communications plans have to be so tailored to the audiences that you're trying to reach, and having a good understanding of those audiences and what you want your research, the impact you want your research to have at the front end is so essential, because then that informs what strategies you achieve. Right now, our center is working on a project that's community-based research project called the Transportation Equity, Climate, and Health Project. And we're working with local environmental groups, environmental justice groups in the Northeast region and in Boston, specifically to conduct research on how we can help improve health equity issues for the groups in those communities specifically. So we have set up an advisory group really tailored to addressing the specific needs that they have and how our researchers can address those. And so in that instance, our audience are those environmental justice groups. It's not necessarily the media or policymakers. It's specifically doing the research in ways that is most effective and helpful to them. But in other, projects we have, it's looking at something that EPA is doing and how our research can help inform, new mercury standards. And so for that, the audience is really EPA. And so trying to think about, what outlets are people who work at EPA reading, like what meetings can get set up that will help inform them about the research that we're doing. And so we try to be really tailored in our communication strategies based on the projects and the research that we're working on. And so, I guess I would say at the front end is making sure your funders understand that and understand the role of communications and outreach when you're working on getting projects funded, because unless there is funding and support for communications and outreach, so much of the work that we do will just get lost in academic circles and not reach people outside of Harvard. And so I think that that's like a really important thing to be thinking about at the front end. And then, I just wanted to say that like our center, we want to be a resource to everyone. So if we can never help think through, rollout strategies or just brainstorm or help you come up with communications plans, please don't hesitate to reach out. Like, we want to be helpful. There are other organizations outside of Harvard that can be really helpful, like nonprofit communications firms, and their job, like Sciline and the Science Communication Network, are really to help scientists who may not have for communications and outreach, to help support them and think through plans. And they do things such as like media trainings and help you think through tough questions, and audiences and reporters, and put together a media list, so that there are, resources out there if you don't have, a team of people to turn to necessarily within the school. But an important thing that, like, we're happy to do, like, we can do media trainings, we can help you work on your rollout plans, like, please don't hesitate in that regard. And I think, what I'm getting at is like the importance of kind of having a game plan for whenever you're doing research, so that you do preparation on the front end, so that once you get to the part where the journal, has accepted your paper and you're negotiating the date for the release of it, that at that point, that's not the point you want to be thinking about communications. Ideally, it's before the paper has been submitted, you have thought through sort of who is your team that can help you with this. Is it like the funder that may have supported the research, people at the school, your personal connections, other organizations that may do similar work. A lot of times we're doing a lot of calls on the front end with different organizations who care about similar issues, to let them know that something is coming, and help jointly think through how we're all going to roll it out and what strengths we have. Some are really good at, digital communications, some are media relations. So trying to think through the different roles that everyone can play is really important, and having that team on the front end. And as Ari was getting at, like, traditional media can only do so much. There are only so many reporters, at the local level or the federal level, or national level, but there are lots of other avenues for communicating research, whether that is working with trying to reach, certain audiences on social media, or, through the entertainment industry. And one of the projects that we launched at the beginning of this year, which we're very excited about and hope to continue to grow, is something called our Climate Creators to Watch. And what we did is we went through hundreds of social media accounts, working with a partner called Peak Action, to identify the people on Twitter, specifically Twitter, Instagram, and TikTok, who are doing really creative work on climate communications, who have large followings, to see if we could tap or build relationships with them. So, we have really strong media connections, which, we're happy about. Like, we know what reporters are writing about climate and health related issues, but so only, so many people are reading articles. We need to also be reaching new audiences. And so we want to have a new list of, people who are doing really important work, or have large audiences and reaching new people through social media. And so we thought, like, are we cool enough to be on TikTok ourselves? And we decided we're not. And so we thought maybe the next best thing would be to find others who are doing really good work in this space, and build relationships with them. So our thought was identify these people and who are talking about climate change, but talking about it in a really specific way, and that they are trying to fight this sort of doom and gloom narrative, that are trying to focus on solutions. And I just got to note that my connection's unstable, so I hope you can hear me, but that are focused on solutions, and are, trying to talk about we can get involved and active. So we specifically tried to find people that were using that approach, because in our view, gloom and doom messaging around climate leads to apathy and inaction, and is equal to, delays. And we want to continue to motivate people and teach them about ways that they can get engaged and improve their own health. And so we announced the list of climate creators to watch this year. And so not only are we building this relationship with them, you know, also hopefully elevating their platforms and creating new opportunities for them, and that it's mutually beneficial for us. And, you know, we're hopefully going to do events with them at the school and have them speak to some of the students that we work with. And so that's just one example of like trying to tap into and create a new audience. You know, tomorrow I'm doing a media training for a lot of these people to help them with their own media relations. And so there's like ways that, you know, we can all help each other in that way. So yeah, I think, you know, I guess if I were to sort of leave you with one thing, it's just trying to think through your target audience and the goal you want to achieve, and then work back from there. And trying to give yourself as much time as possible to think through your plan of action. So I am, you know, happy to stick around and answer any questions you might have, and can be useful. I know my colleague Anna Miller is on here as well, and I know I see Amanda Yarnell from the Center for Center for Health Communications. But we're excited that she's joined the school, and we hope to be partnering with her as well as the year goes on. So I unless they one part. I see a question from Eileen. They have control over the messaging for sure. But you know, there's like, our hope is that when we have a new research paper coming out, we can share that with them, and like, you know, that they'll hopefully post about it and share it with their followers as well. So they'll get our press release, or they'll see our social posts, or we'll tag them. And hopefully there'll be a way to directly communicate with them in addition to reporters and other tactics, but it's just one example.
I think one thing, Eileen, your question raises mine, is one of the pieces of feedback I've gotten is, well, how do you know they're not going to distort what you say or take it and run with it in crazy ways? And I'd say, you know, not that was the question you asked, but I think it's one of the things that researchers often say. And I said, well, one thing, have you ever seen what happens in the real journalism world with scientific findings? And the second is that we did not pick these folks at random, right? There was actually a very intensive selection process. And it turns out that when they do, like, if you go to their websites, you'll see these are immensely high production value pieces. They spend an enormous amount of time doing each one of their pieces. And I would argue they probably spend, well, there's not one of them that wasn't produced over many days, when the average journalist, even at the best articles, has maybe 20 to 30 minutes. So now, the other piece, which I tend to fall back on, because I think there's always the concern that, you know, we're affiliated with them in some way, like we've endorsed them. So, you know, we have not said that. We're not saying we endorse everything they ever say. And to me, it is very much a trade-off, which is we could sort of put ourselves in the position of saying, we'll let the journalists say whatever it is they want to say. And in some ways that is the relationship we have here. But I think it's one step better, which is that they may ask us a question. They may say, you know, we're working on something that has to do with something you told us. Can you help get this story right? Which is something a journalist, in my experience, almost never does. They will reach out to you about your research. But and to be clear, this is experimental, right? I don't think anyone is doing this. And I think one of the things I'm hopeful we can get supported to do is to actually do some research around the ideas we've talked about, which is, how do messages that come through the climate creators to audiences resonate in the social media universe versus, for example, coming out of my Twitter account? Or what is the level of, you know, accuracy that would come through, you know, these two channels? I think there's some really important questions to dig into around this. And I think we need to figure it out, because the data is very clear that everyone's getting their news on social media now, or not everyone, but, you know, the trend is clearly in that direction. So if we really want our work to be translated effectively, we have to figure out the best pathways to do it. But there's real hurdles. There's no question.
I'm just waiting, Ari, for you to come up with your own TikTok challenge, and then,
Did you hear that part, Jamie, where Liz said we asked ourselves if we were cool
Yeah,
enough? I was the first person raising both hands.
So
Yeah, I mean, and a lot of people have huge followings, with thousands and thousands of people, and they want to get it right too, right? Like, it's important for them and their credibility. And a lot of the people we selected have academic backgrounds. Several of them are PhDs, and they are, coming from a science background.
There's one oceanographer who studies ice cores. There's another who got a PhD from Oxford, but decided not to pursue PhD research. Again, it was not a randomly selected group of folks. It was a pretty selective group.
So I think we're going to have a nice question and answer period at the end, but there's room for one or two more questions if anyone wants. I have a question, but I'll defer to the group if others want to ask anything. So I was going to ask this, this may not be answerable, but I'm struck when we talked before and again today that, you were it was very clear that messaging that was gloom and doom was not going to be effective. It doesn't engage people, it doesn't motivate them. So you need solutions-oriented communications. But I feel like there's a lot of other topics where it's less clear what's the most effective angle. And I'm saying that seems like the effective angle intuitively. I don't know what the exact data are, but do you have suggestions about, like what's the sort of focus or tone that ends up, how do you figure out what's the focus and tone that might work for a given topic? Is it just intuition? Is there sort of some way to systematically try to think about that or investigate that? Does that make sense, that question?
Yeah, I mean, I guess it's a little hard to know without knowing the topic, right?
Yeah.
But
yeah,
I mean, there's a lot of research on communications that are out there. Like, there has been a lot in the climate space to know sort of which messages resonate and which ones don't. But Marshall Gans is he's at the Kennedy School, and he's done a lot of research into how do you build effective movements. And when I worked on the Obama campaigns, a lot of the messaging, the approach that we took toward messaging was based on work that he did. And what he talked about was the need to sort of acknowledge and relate, and then you share your values, and then you pivot to accomplishments or the goals that you want to see, and then you contrast it, with what would happen if we didn't do anything. And so a lot of times I try and think in that structure where you acknowledge and relate, you share your values, you pivot to the accomplishments or the goals, and then you contrast them. So with whatever the topic is, you trying to build that connection or share your values and your personal story, and making those connections, I think always is effective. And trying to communicate something.
I'm gonna add one thing, and then I'm sorry I gotta run, but I think one of the advantages, or one of the potential advantages, and this is again an experiment, is I don't know the answer to that question, Susan, but I expect that the climate creators will have a better insight as to what their audiences want in their tone. And the other side of it is that because not everyone is expecting the same tone or will be motivated by the same tone and characterization, having a diversity of messengers is really helpful. So it is in a sense a democratization of the issue, so that people can find the voice that resonates with them the most, which may not be the New York Times. And in academia, I think we get more credit for being in the New York Times, but in the real world, I'm not sure that actually is what we care about. The other thing I'll say is, shoot, there was another thing there. Anyway, couldn't have been that important. Thank you again. Great to see everybody, and really, really grateful for the chance to be with you.
Thanks, Ari. I really appreciate your joining us today. That was great. All right. So Jamie, you want to?
Sure. So we're moving sort of down the train. Our next speaker is Dr. Rebekka Lee. She's a graduate of the School of Public Health, a master's and doctorate, and is working as a research scientist, but today is sort of putting on her hat as the director of community engagement for Harvard Catalyst. So that's we asked her to sort of speak with that hat on, but I know you wear many relevant hats, so I wanted to make sure that we sort of acknowledged all of those. But take it away, Becca.
Thank you very much. And I have also gotten a few unstable notices, so wave your hands at me if you can't hear me. But I'm going to share a few slides. I hope that's okay, because I want to make sure I kind of visually share all the work that we do with the Harvard Catalyst Community Engagement Program. So great. Can everybody see that? Okay, wonderful. So for today, I really wanted to give you an overview of what the Harvard Catalyst Community Engagement Program is. We are part of our Harvard Clinical and Translational Science Center, where there's many resources available. You probably know the profiles or biostat consults, but you might not know about the community engagement work that we do. And I can see my video is already skipping, so I might just turn my video off while I have the slides up, if that's okay with everybody. So our goal is to increase the pace of adoption of evidence-based programs and policies to promote health and prevent disease. And we really do this all in alignment with community identified needs and interests. So we have a community advisory board that leads all our programming and helps us figure out what we should be prioritizing. And we work with our partners collaboratively to identify the opportunities and strategies we take. We do a lot of training for people all the way from our students up to quite senior investigators. And these are kind of the values that underlie all the work that we do. Ooh, missed a slide. One thing, so you were all just talking about the dissemination phase of our research, and that is a really important part of all of this. But we think about equity engagement across the entire kind of phase of a research project, everywhere from what topics are you going to select to study in your research projects before you write your grants, before you design your protocol, all the way through what are the study design characteristics you take, how will you collect your data, how will you analyze and interpret that data. And we also think about community engagement not as this yes/no, but across a continuum. So everywhere from informing people at kind of this dissemination piece about the work that we do. So making sure both at the dissemination side, but also informing people about a study that they might be eligible to participate in. So in the recruitment and engagement side of things. And then consultations are also a key part of the work that we do. So how do we get community input on our studies? Again, across the continuum from idea to dissemination. And then there's the more collaborative aspects. So how do we have this two-way engagement involving people in identifying the ways that we structure our problems and identify solutions, truly collaborative work where we're sitting at the table together, partnering in work, and then kind of the empowerment stage of this would be more in the community-based participatory research paradigm where your final decisions are made by you and the public and really prioritizing members of the public or people in the community. And so the thing I'd like to emphasize here is, again, community engagement isn't just a yes/no thing. It could really happen along this continuum. And if you're newer to community engaged research, you can start at that inform side or that consult side, and then hopefully kind of get to a more collaborative research project as you move through your program of research in your career. So the number of initiatives and services we have in our program has really been growing over the last few years. In terms of training and skills development, we have a range of seminars and podcasts that are available. Just had a podcast launch today around a community engaged research project about WIC participation and policy change. We do small group trainings where we'll meet with a group of folks like you who all might have a standing meeting and want to learn about a particular topic. And so we do that type of work. We have student practice placements where we place about 4 students twice a year with our community advisory board organizations to do kind of a mentored internship project. And the thing that makes this a little bit different than normal is we have longitudinal placements. So we think with our CAB members about 1 to 3 year projects that they have where students can come in and out, and we can kind of be the glue between the students that might be medical students, they might be public health students. And the thing I think that's so valuable about this is that they're able to really make a larger impact on the community-based organization and their work. And the community-based organization in turn gets multiple perspectives from different students over time. We have a community advisory board, like I mentioned. We do something called community engagement studios that I'll kind of walk through it in a bit more detail in a second. And we have our community coalition for equity and research. I'll also talk about that a little bit more. And then we offer pilot grants. We do one-on-one consultations. And if you're interested in implementation science, which we think as kind of a branch of doing community engaged research, we have an implementation science working group. So let me tell you a little bit about our Community Coalition for Equity in Research. Amidst the COVID pandemic, we really started focusing more on a problem that had always been there, but was really surfacing more and more, that research efforts tend to engage communities after studies have been designed. And we were having lots of folks come to us wanting help with recruitment when it was far too late to really be asking for help with recruitment into their studies. And so we really developed this coalition with the need for a source for high quality community input in research as it's being developed. So I think of this as from when you're working on your grant proposal to anytime before you put in your IRB protocol. And this is a trusted and trustworthy source of information with community partners where they can get input, where you can get input on trials as well as other types of research projects. And so we have now this standing trained community coalition that provides feedback on research to increase equity and the use of community engaged research principles. We also see this as a communication vehicle. Once a research project is vetted by this coalition, there's 14 highly engaged and connected people, connecting to our last conversation, who can let their networks know about this study. So if you're at the recruitment stage, it can be a great way to get the word out locally about the research project. And then we really prioritize that this is co-led with a community partner, with Michael Curry, who is the executive director at the Massachusetts League of Community Health Centers. And we also have 2 co-chairs that bring a variety of different perspectives from the coalition itself. So a few highlights to share with you. So it's a 14-member coalition. We co-created this health equity review rubric that I'll share with you in a second. We've reviewed 8 studies to date, and they've been across a really wide range of health topics. So we've done 2 genetic studies, 2 that are more cardiovascular disease, 2 COVID studies, also a cancer study and a health policy study. So many different health topics. We've seen research projects from the BI, from Brigham and Women's, from MGH, and from HSPH. And we've engaged everybody from postdoctoral fellows up to full professors. We've received really positive feedback from all the researchers. We do a short little evaluation every time they come through, so we can learn and improve on our process. And just I can tell you exactly our coalition members during the Q&A if you want to know more, but this is just a nice snapshot of who are these coalition members. They're immigrant advocates, they're religious leaders, they're members of our local health department and civic civil rights and social justice agents of change. We've got folks that maybe are on boards of health centers or are practitioners in health centers. And we have a climate justice volunteer who is an amazing advocate. So I wanted to just share, I'm not going to go through all the details here, but just to give you a sense of what does this health equity rubric look like? What are the types of things that the coalition is looking for? So every study that comes through, we look at it through the lens of these planning considerations. Also, all these different health equity considerations in the space of recruitment and consent. We also think about participation. So once the study begins, is the participation burden clear? Does it minimize harms? Things like transportation and meals, and making sure methods and measures are free from assumptions about participation. And then dissemination considerations. And so I also won't go through every detail of this, but it gives you a sense of what we do is on an ongoing basis. On the left, I come to meetings like this to let people know about our coalition offerings. We're spreading the word also through IRBs, which has been really effective. We will then, about 2 to 6 months after we kind of meet with somebody for the first time, they'll bring their study to the coalition for a 1-hour kind of review period. You can see that in green, there's also optional kind of pre-meetings and post-meetings. So you don't have to get all your feedback in one day, but we have a pretty clear process for how this all rolls out. And so if you were a researcher interested in the coalition, you would meet with me or other leaders at the community engagement program to discuss the alignment of your project with the coalition goals and timeline. You'd prepare a 2-page study description and a 10-minute video. We actually find this complementary kind of video and a text document to be really useful for the coalition members. So before they meet you for that facilitated discussion, they have already kind of met you and heard your perspectives. Then you participate in this facilitated discussion with the 14-member coalition, and you'll get a 2-page summary of the coalition, highlights and recommendations for your work moving forward. Then I'll just walk through a couple more of our services, and then we can ask questions at the end. So we also have consultations. So our team specializes not just in community engaged research, but like I said, implementation science and mixed methods. We do one-on-one consultations with researchers and community stakeholders. And this begins with a 30-minute Zoom call, but we also will do up to 2, maybe even 3 additional meetings, resources, written feedback when you are interested in it. We also do referrals to collaborators, which can be really helpful. And those collaborators could be community collaborators, but also maybe a co-investigator who could be helpful on one of your studies. I will mention Rashawn twice today. He's somebody I've referred somebody to in the past, and that's been a great way to make sure that the rich experience within our network of researchers and individuals at Harvard can be well connected to one another. So the types of things we do in a consult would be things like advise on community advisory board development, maybe review community engaged grants prior to submission, discuss strategies for building your team's capacity and doing one of those small group trainings. We can provide input on surveys or interview guides that would be used in a community-based study, and also think about more inclusive recruitment methods. And then our community engagement studios, these are guidance sessions, and the thing that makes them different from the coalition is that they're usually tailored around a specific health topic. They're paired with our pilot funding opportunities at Catalyst, and they are similarly a collaborative dialogue between researchers and community stakeholders. These are the different topics that we've done community engagement studios on in the past. Environmental toxins was actually one of them last year. We reviewed 10 studies that were in this kind of environmental toxin area. We brought in environmental justice folks. We brought in folks that were involved in occupational health and safety, people who were on the green team at their synagogues, a wide range of folks, folks that work in local health departments, but in the environmental health space. So they bring that topical expertise and also that community expertise. And then the final thing I wanted to talk about was our new training. This is a online course that is self-paced, and I co-direct it with Rashawn. The goals of the training are first to kind of introduce folks to community engaged research. Then we get into really practical skill building around cultivating effective collaborations, thinking about qualitative and quantitative methods that would be tailored to a community-based study, thinking about how you would create community advisory boards and work plans that really embed community engagement. We have a lot of vignettes throughout that you'll see that help you hear from the perspective of both researchers and from community members and practitioners why they see the benefits of community engaged research. And we have a last session that's more on kind of incorporating the community engagement into research and practice. So how to write research grant aims that promote community engagement, and then how do you bring community engaged research principles into practice settings? Things like understanding the stakeholders that you want to be reaching out to and thinking about dissemination and policy change. So I know I just talked a lot. And there is something in the chat. There's one question. So I'm going to stop sharing my screen and see if anybody has any questions or comments. And I'll turn my video on and hopefully you'll be able to see me. Great.
Yeah, thanks, Becca. So I think, yeah, Susan put one in the chat, and then comment probably more than the question.
So Susan said, did I understand correctly that coalition reviews are first vetted? That is, not everyone who requests a review ends up getting one. Great question, Susan. In full transparency, we vet everybody because we want to get to know them. We've never said no to anybody yet. We might get to a place where it's so popular that we might have to, or put you on a waiting list or something. But to me, that first meeting is this best for the coalition, or would it be better for a consult, or should you take our class first and then come back? So far, I haven't had to like send people different directions, but a nice 30-minute introductory meeting makes sure that it is a good match. Any other questions?
And I think more of a comment that, you know, I think this is going to be a really interesting. So through the NIEHS Center, we have some pilot project, you know, calls, and I think, you know, we've usually, you know, sent them to Gary and to Anne, but I think this could be an additional resource where either maybe for the pilot, or, oh, once you have compelling evidence from the pilot, maybe you should go, you know, kind of use this service to make sure you're doing things, you know, in a thoughtful way. So I think we may send some more people your way, and then Susan's comment will become more important.
Yeah, no, that's awesome. So thinking about when would be the right time to send somebody to us for a consult or the coalition. Also thinking about is the community engagement studio that's tailored around environmental toxins or environmental health or whatever that is. We actually have done that well once, so now we actually have those networks. The hardest part of a community engagement studio is finding that topic level expertise, whereas this health equity coalition is very like broad input, not as topic specific. So lots of different possibilities for collaboration for sure. Looks like Gary, you have your hand up too.
Yeah, thanks, Becca. Thanks for this great information. Really great to hear this. I'm really curious, this might be a bit of a tangent, but I'm curious about the 14-member coalition. So how much time do you ask of those folks, and do you compensate them? How do you compensate them? I'm thinking about other places where we could set up similar structures to really get good community input.
Great question. So they all attend monthly meetings that were an hour, but we couldn't do it all in an hour, so now they're an hour and a half.
Yeah.
So they all attend Zoom meetings for an hour and a half once a month. And then I estimate that they spend the same amount of time doing review. So like another hour and a half on their own, looking at the video, filling out the rubric, reviewing the 2-page summary. And so 3 hours a month baseline. And then there are some people who are putting in more time. So, and it took a while to kind of figure out who those people might be, because everybody has day jobs, except I think 2 people are retired. But for the most part, they're doing this on top of their work. So, you know, we do those meetings at lunch hour. So most people can take off that lunch hour to drop in. And then we've also developed, like I said, that co-chair piece. So our co-chairs attend an extra hour a month. And then we now have a working group that I didn't even share about. So one of the things that has emerged out of this is that there are key topics that come up every single time. Language, things are not translated into other languages.
Yeah.
So this is such a limitation. Consent forms are really dense. Recruitment materials are really hard to understand. So we now have this working group that is developing like tip sheets and best practices in the coalition voice to hand to people before they come to the coalition, and they are putting in extra time. So we're starting to see like the interests of people wanting to like bump up closer to 5 hours a month. So, and we do compensate $20 or $25 an hour. I don't remember my different groups, but that's what yeah.
No, thank you. That's really interesting. Thank you.
Yeah, no problem. Okay, I'm gonna look in the chat now. Looks like.
I think Eileen was drawing some
And
talking about the implementation science. So there's our next seminar is actually on for the series.
Oh, wonderful.
The center is on implementation science. So good.
Okay, wonderful. Well, I will make sure I put all the contact information in the chat to join our implementation science working group if you wanted to, but it does look like, Anne, you had a question. Would your studio venue be a good way for us to get a community group academic partnership moving forward on the pilot project? So kind of similar. Do you want to add to that, Anne?
Oh, I just wondered if we could use that type of setting for us to formulate a new pilot project, for instance.
Yeah. Yeah, no, absolutely. It definitely could be. And I'll just say one way we've partnered, I think I shared the list of different topics. The prostate cancer screening one we did was the only one where we kind of like tag teamed with another researcher. So we provided all of the like facilitation and structure and all of that. And then they paid the like incentives and travel and things like that to the people. And that was a way that we like did a studio in partnership. So I think that's very open, that like we have the structure, you wouldn't necessarily have to recreate everything, but we could figure out a way that, you know, you do some of it and we do another part of it and work together. Yeah.
Right, thanks.
Mm-hmm.
Okay, so we keep thinking about topics, but Gary, do you want to kick it off next?
Sure. Thank you, everyone. It's and thanks, Becca, so much. So it's my pleasure to introduce our next speaker, Rashawn Nalls. Rashawn has served as the Director of Community Engagement within the Office of Diversity and Inclusion at Harvard Chan since 2015, in addition to serving as an ambassador and connector between the school and committees surrounding the Longwood Medical Area. He's also the co-director of the Leaders in Health Community Training Program, interim director of the Equity, Diversity, and Inclusion Fellowship, a Rose Service Learning Fellowship Committee, and is co-instructor for the SBS 501 CVPR course. His professional background includes over 15 years working with Boston area community-based nonprofit organizations with an emphasis on positive youth development, community organizing, and political advocacy. We're really thrilled to have Rashawn with us today. I'll turn it over to him.
Yeah, thank you, Gary. I appreciate being here with you all. And I'm also gonna share some slides just as a visual guide. So you're not all staring at me, and hopefully this can be complementary to our previous two speakers. And even though we've been in Zoom for 2 years, I always struggle with sharing the screen. Y'all seeing my screen?
Yeah, we see the slide view version. So if you could put it into, yeah.
It's better.
Your
We see the
presenter.
notes version.
Oh
Yeah.
my goodness. See this?
No, we're-
To the far left, yeah, swap displays. You're good.
let's see. Is that better?
Perfect.
there we go. That's perfect.
All right. All right. So thanks for joining us. Sorry for my technical skill deficiency. But again, Rashawn Nalls, I serve as the Director of Community Engagement at our school. And I've been in my role for about 7 years. And so the first slide I have, I'll go back to my beginning actually. Just to talk about some of the resources that we do have, not to be duplicative of what Rebekka shared, but Rebekka and I co-lead, co-direct a program called Leaders in Health. And this is really geared to support our community partners, local Boston-based, greater Boston-based nonprofit community organizations, where they can really come and learn about public health as an academic field. We found, which I'm sure none of us are surprised that there's, especially pre-pandemic, there's just a lack of understanding of what the academic field of public health really means in the work that folks do. So this training has been pivotal in providing almost like a public health one-on-one, but more importantly, it gives folks an opportunity to learn different skills, terminology, frameworks in hopes that they'll be able to apply a public health framework to their respective work. And one thing we really found out too is that a lot of our community partners are also in the same state of tension where they're trying to figure out what does a partnership with an academic institution look like? What is on the table? What is off the table? What is research, right? I think we use the term research because it's a part of our profession, but to folks that, are not researchers, research means a lot of things, right? How many times do we hear somebody say, I'm going to do my research, and that just means like a simple Google search, right? So I think there's varied understanding and experiences of research. The other is the Role Service Learning Fellowship, and this is a resource for students. And I think faculty and other researchers should be aware of this. So twice a year, once in the fall, once in the spring, my office and the Office of Education, we offer a Role Service Learning Fellowship, which provides a stipend for students that have a community-centered project. So I didn't say community-based participatory research. I didn't say community-engaged research. I said a community-centered project. And the reason that we call it that is because our students have varied experiences, right, with engaging with communities for their work. And not everything fits that very narrow criteria of what community-based participatory research is. And we want this opportunity for students to be able to have resources to support their work. So students are eligible to receive funding up to $10,000 for a specific project. There's an application process. If anybody's a student here that's maybe interested, the application deadline's due this Friday, April 8th. But more importantly, we hope to develop students, right? Their understanding of the different approaches to working with community, having them be reflective on not only their role as researchers or public health practitioners, but also what are learning examples of learning opportunities when they're engaged with their work. So no matter what your research agenda is, what your project proposal is, it won't go that way. And so when you're actually in the field and you're trying to enact and what you propose, right, you're gonna meet people that aren't responsive for whatever reason. The project as you described it may look very different once you actually get to the organization and start engaging. So we believe there's really teachable moments for students there. And of course, we have several community engaged courses. Myself and Jocelyn Chu teach a CBPR course. We actually expanded it into a 2-part course. So SBS 501 is really where we focus on the theoretical concepts of what community-based participatory research looks like. And then we have SBS 551, which is part 2, which is the practice component with. So in part 2, you actually work with the community partner on a community identified issue, whether it's evaluation, whether it's engaging with a specific population that they're serving. And we found that we really needed to separate those two. So as the previous speakers alluded to, community engaged research is a lengthy process, right? So we don't want to set our organizations up, our partner organizations or our students with saying, hey, we're going to figure out something in 8 weeks, which is really hard to develop anything meaningful in 8 weeks. So, even with these projects, we try to identify kind of low priority, high reward topics. So one thing we're always mindful is the capacity of our community partners, and any work that we're having with them, we hope it doesn't decrease their capacity. So those projects are, if you had a program that you're running that the evaluation could be enhanced, maybe students could look at that. So if they are able to develop something that's meaningful, it can enhance and improve on the work that you're doing. If it's a total disaster, it doesn't hurt anything that you're doing. So we're very meaningful with that. And I think one thing for us to focus on is what is valued by our institution or our academic department when it comes to community engaged research. So just looking at, faculty as this model, we can debate on how valued teaching is for faculty at this school. Those that are faculty members probably have a lot to say about that. We can, I don't think it's debatable on how much we value community engagement, right? I don't think I think it's well intentioned. I think there's a, overarching personal mission that folks have to support community, but I can't necessarily say that it's valued by institutions. We know institutional service, again, we could debate where that's valued, but we do know that research is valued at our institution, right? And how do we know what's valued, right? What's rewarded, right? So if you talk to your colleagues, whether you're a student, whether you're a researcher, what does your department, academic department, or your institution value? And how do we know this is valued? One, you get rewarded for it. So if anybody is seeking promotion and tenure, what is valued, right? Research publication, the generation of resources. Those are things that, are explicitly valued and kind of determine how we set our research agendas, what efforts that we focus on, and how we allocate our time, right? When it comes to community engaged research, however, maybe, I don't want to call it a dirty little secret, but I've heard from folks that they've been told not to focus on community engaged research, right? Especially if they are interested in becoming a tenured faculty member. And it's not that the institution, I think, or the academic department is saying that that's not good work, but it's not valued, right? And how do we know it's not valued? Because there's no resources for it, right? If you want to do any type of community engaged research, the grant world is very limited in what's available. There's very few institutional supports that are provided to faculty, to students in regards to engaging in this type of work as well. And so when we talk about researchers, thinking about what are the resources, and maybe these are conversations that we can have at the departmental level while we simultaneously have this at the institutional level, but what resources are available for researchers that want to do community engaged research. So Becca shared the tremendous work that's happening at Harvard Catalyst, which is one resource, right? But how well known is it? Do you have the time to take the community engaged research course that is offered, right? Will folks be supported, especially depending on their roles as researchers with doing something like this? What are the training and skill developments that are necessary for faculty who want to engage into this work? And what type of support is provided? So anybody that wants to do this work can speak to the complexity of community engagement, right? So you think about relationship building with community partners, as Becca alluded to, right? A lot of times, well-intentioned researchers have a proposal that they know is due, say, Friday of this week, and will reach out to folks like myself or folks that they may have in their personal network in hopes of having a community partner sign a letter of support, of having this conversation and dialogue. And the timeline aside, which is very problematic, but there's more than just getting that letter of support, right? There's ongoing relationship development, right? There's ongoing support. Are you going to attend this community partners community meetings? Are you meeting weekly? Do you have the staff to support this? We probably know you don't have the time, right? And these relationships are really difficult to facilitate on an ongoing basis, right? Do you have to form a CAB, a community advisory board? If so, who is dedicated to doing that work? A lot of times these things come post are getting a grant or post our application of a grant, and we haven't thought about who's actually going to do this work. And of course, as our first speakers alluded to, dissemination strategies, right? So how are we going to produce valuable research that benefits us as researchers, but also benefits the communities and populations that we're working with, right? So if our goal is to, produce an article in a top tier academic journal, that has a very clear benefit for us as researchers, right? We definitely are adding to knowledge generation in the academy, but what benefit does it ultimately have for our community partners? What good does that, how do they leverage a published academic journal to support the work that they're doing? Right. And of course, these sustained and continued relationships. So even after, say, we were successful with securing a grant, we were able to develop a partnership with a community-based organization to do our work. What happens when the grant is done? Right. A lot of times we don't think about that, especially at the planning stages of our grant. But most times, if not always, our research does not end whatever issue or concern that we were focused on. And so this community group may have worked with you for the past 2 years on a research project, let's say on lead paint, or lead levels in the public schools water system, right? If we leave and that problem is not rectified, community groups, Boston Public Schools, they're left to deal with this problem, right? While we move on to something else. So there needs to be those sustained relationships. And sometimes when we have our example of institutional defined engagement, it's limiting in many ways, right? And I don't know if we always have a shared understanding of what community engaged research entails, right? And this is just one example, but it should engage faculty members and students in a collaborative and sustained manner, right? We must conceptualize community groups as being outside of academia. Believe it or not, I've heard so many times where folks are like, I'm going to work on a community of academics, of researchers. I'm like, what does that even mean, right? Or who is your community? Oh, it's a group of folks that are already affiliated within our institutions, and we got to push ourselves to conceptualize that as being outside of academia, and really, and we looked at that continuum of community-based research, right? But to truly do community engaged scholarship, we have to have shared authority at all stages of the research process. So this comes at the conceptualization stage when we're thinking about, hey, I have this area of expertise. I have some relationships with local community partners. Let's discuss what a research project could look like, right? Let's discuss who should be involved. Let's discuss power dynamics and if there's co-authorship and co-ownership of whatever our research does produce, right? And a lot of times we fail to do that. And so often our results are just products that are peer-reviewed publications, collaborative reports, documentation of impact. Maybe there's some ways to get some continued external funding, but it's often one-sided in our approach. And a thing we always hear, I've heard it a lot when I'm working with community partners, and I have a more sophisticated understanding of community engaged research, thankfully, than I did 7 years ago when I began my role. And one comment I always hear from folks outside of academia is communities are tired of having research done on them. And I don't know what that means, right? I think sometimes people speak for others. Sometimes people talk to history, right? And if we think of some of the harm that's come to communities, marginalized communities, communities of color from research, I think that's what people are referring to. But I also think there's a misalignment of what the goals of research could be, right? So if the research is one-sided, where the researcher or the institution is the primary beneficiary of the research, I totally agree that communities, however we're defining communities, are tired of having that research done on them. But if we're talking about transformative work, right? Well, we're talking about social justice, like efforts like environmental justice, right? Well, we're really trying to challenge the existing inequities that are there, where we're really trying to be disruptive and dismantle systems of oppression. I don't think communities are tired of having that research done, right? And I think it's more of how we're wording it, not do the research on us, let's do the research together, right? But we need to come to a place where we're able to have a common language, to have a common understanding of the terms. And there's so many terms that are used when we talk about community engagement. So you see this list of the Carnegie applications of what terms surrounding community engagements are used. So everything from service to the community down to civic engagement scholarship, right? And so we need to be meaningful and intentional about the terms that we're using, even if we're not there on an institutional level, but within our department, like environmental health, when community engaged research is mentioned, folks should have a shared understanding of the term and agreement of the terms that we're using so that we're all on the same page. And of course, it's a balancing act, right? So you have your research agenda, and there's some questions that I would say for any researcher that is thinking about doing community engaged research. So one would be, what is my area of research expertise, right? It may not be in community engaged research, right? It could be in, indoor air pollutants. It could be in whatever area it is. And does that match with what the community partner that I'm hoping to work with actually cares about, right? So if I'm interested in Gary, I know you do indoor air pollution works, and I know it's tremendous, but if that's my area of focus and my community partner cares about trauma and healing and gun violence, right? We have this mismatch, right? From what the community cares about, even though it is very beneficial to their health, but sometimes we're trying to, there's this tension on what our agenda is and what the community agenda is, right? When we look at funding, right? Do we have the funding for this? Are we being transparent in what funding looks like? A lot of times community organizations get excited about the possibility of funding that can occur through academic community partnerships. But in actuality, very little of the funding goes to the organization, right? Which can lead to, disappointment, resentment, misunderstanding. So we have to be transparent with that. And so I would ask myself as a researcher, the first question I would ask is, should I be doing this type of work, right? Am I the right researcher to do this? And I think that's an honest question to ask yourself. You think about your researcher positionality, right? Do I have the skill set? Have I thought about the different impacts and history of the communities that I want to work with? Have I thought about my own social identities and what role and how that affects the power dynamics and my framing of research as I enter this project? And sometimes we may not be the best person situated to do this, but we do have colleagues who may be better situated. So maybe we broaden who our research team is, right? The second question I would ask is, look at my notes. Why do I want to do community engaged research, right? What's in it for me? And really think about, how this benefits my career, my research agenda, and seek that alignment with community folks, right? And it should be that alignment. And we have to be clear. And sometimes we have to have transparency in our conversations. Like, yeah, I do need to publish a academic article for this study, but also I want to translate that into a medium that is helpful for you to continue your advocacy efforts, right? As a community partner, right? We really have to ask ourselves a lot of these questions going in. And I'm gonna end for time, but I think through my role as director of community engagement in being thought partners with folks like Becca and other folks at the school that are focusing on community engagement, we do need to build these resources into our institution where we are able to have thought partners with researchers. We are really able to provide that logistical support that goes around community engagement, right? So even if you are successful with building a relationship, can you attend the monthly meetings of your community partner? Probably not, right? People have children, people have work, people have busy lives. But is there a role that the school or my office, if it was to expand, that could provide that additional support, right? How do we know the history of the communities and populations that we work with? Quick story, there was a big grant that I was a part of the research team in securing. It was a study on Boston and just organizations that were doing good in Boston. And it was very apparent to me after the first 2 meetings that the primary researchers in this group knew nothing about the city of Boston. They didn't know the different neighborhoods. They didn't know the political dynamics that existed in the community, in the city. They didn't know the racial and ethnic demographics of the people that lived in the city. But yet, because of their prestige and accolades around being researchers in academia, they were awarded this this grant. And I really had a lot of concerns about how good and how valuable can the research be if the research team is ill-informed about the community that they're supporting. So hopefully we can continue to be thought partners in this and really make it so that both on the academic departmental level, there's resources that are being provided to researchers and students who want to do community engaged research, and on the institutional level, that there's resources that are being provided. So you researchers don't have to fight for all these grants and sacrifice all this time, where there's really some funds that can support your community engaged efforts. Small things such as, how do we provide stipends for folks when they come? How do we provide meals? If we have guest speakers in our classes, or we have a community advisory board, how are we paying people for their time and showing them that we value their relationships? So I'll end right there, and stay around for any questions.
Thanks, Rashawn. That was great. Really appreciate that. So we have time to open up the floor for a couple of questions at least.
We can let people think about them. And
yeah, I have a question. Rashawn, that was wonderful. Thank you. So I sort of hear this recurring theme, which resonates with me, that there's just not necessarily a lot of funding to support this work in the way that it needs to be done well. And it sounds like you're putting in a plea for institutional support, or, do you have any optimism that that's going to change? And, is there increasing institutional or departmental interest in providing funding?
I cannot speak on the departmental level. There's probably people in the space that know more about that than, but I say on the institutional, so I have a working budget that is not very strategic on how I use it, but for people that I partner with, whether they're faculty, whether they have different roles within the school, like, I'll make it happen, so folks are like, hey, I'm doing this work with organization X, Y, and Z. I'm realizing that, they need to be compensated for their time. I've been able to finagle things that probably, policy says that we shouldn't be able to do. But I really believe that folks should be compensated fairly for their time. They're taking time out of their schedule. They're providing a valuable resource, and there's ways to work around it. And I think sometimes there's policies that restrict how we can do that. A lot of times it's personalities that restrict how we can do things. And so they'll say it's a policy, and I'm like, it's not a policy. That's how you do things, and we can work around it. But I do think we need to establish a more formal and accessible way for researchers to access those types of resources and funds. It won't be able to fully fund any research projects, but if it could, provide additional support. So, some things you just shouldn't have to worry about, I believe. I think I'm optimistic that can happen sooner rather than later.
Yeah, that's great. Thank you.
Becca?
Yeah, I'll add to what Rashawn said and also say, I think it's great that Rashawn has that budget that's flexible and might be able to help people make an existing project or one that was just funded, community engaged. One thing that we're thinking about in our kind of next phase of material development is, I think researchers need to be trained on how to build community engagement into their budgets when they're applying for things like NIH funding. They should get money from Rashawn maybe once or twice, but they should learn how to like truly fund community engaged research. Like that would be the best practice here. And I do think, there's debates, but when we have developed grants for especially large center grants, putting large amounts of money into service agreements to community partners, small amounts of money into incentives for community partners at an individual level. So getting people, and we have a little bit in our course about like, here are the different ways you could give money to people. Like, I think some people don't even know how they could or what that would look like. And so I think people need to be trained in that type of thing. So, get some support from the institution, but also, walk the walk and not always rely on the institution.
Liz?
Yeah, I would just add to that, I think staying in touch with the funders throughout the process to sort of let them know how it's evolving can be helpful. Like we've had to go back to one of our funders to say like, hey, if we really want to do this right, like we need to do X, Y, and Z, and this group needs some more funding in order for it to happen. And a lot of times, the foundation will have the same goal that we do with the project. And so, they can find ways to put more money towards it if you just ask. And I think that's sometimes, something people are hesitant to do, but can result in a better end result.
I might just add that put in a plug for some of the resources that exist within the center that is sponsoring this event. We have pilot project opportunities up to $30,000 for projects that we don't typically get enough projects that are community-based. We're always looking for more. So that's an opportunity within environmental health to get additional funding. Also within the community engagement core, we hand out small pots of money up to $3,000 for community action funds for something that's very direct with a minimal application, just to get some funds into the hands of community partners. So just wanted to add that to the mix. So this way, not everyone is knocking on Rashawn's door.
I would add, and sometimes it's fun, and I appreciate both Becca and Gary what you said, but sometimes I think we had these conversations before, Gary. There's a community partner and they're having a gala, right? Yeah. And that means so much to that community organization to have the support of the institution.
Yeah.
And it may not have been written into your grant, your department may not have the funds. That's something that's a perfect opportunity for you to reach out to me and say, hey, Rashawn, how can we support this organization? Yeah. I go, oh, we can buy a table, right? And it's a great opportunity for some students, some folks that are close to the research project to go there. And those things really do matter. But oftentimes we don't understand how important that is to our community partners.
Yeah, that's a great point. All right, if there's no other, so just in the interest of time, I think we'll move on to the next thing. Thanks so much, Rashawn. Really appreciate it. So I'll turn it over to Tamara.
All right, so we're at that time point where we're getting ready to transition to a moderated Q&A, but before we go there, I first want to take this moment to introduce Amanda Yarnell, who some of you may have met before, but had the privilege of meeting her just the other day. And so she's our new senior director for the Center for Health Communication, which sits within the Department of Social and Behavioral Sciences. And Amanda is reimagining what this center can really be utilized for and how it could really assist so much of the work that we are trying to do. So much of kind of impacting communities really starts with good communication and particularly good health communication. So Amanda, do you want to say a little bit more? We're going to have Amanda back at a later date, but I did want her to be able to introduce herself a little bit more.
Yeah, I'm only 2.5 weeks into my tenure here at Harvard, so I'll be super brief and just introduce sort of the idea around the rebooting of CHC, which is really to better prepare Harvard Chan community members to influence policy debates, to counter misinformation, and to increase the public's trust in health expertise. So I come from a journalism background. I've spent the last 2 decades in science journalism, running newsrooms, teams of reporters, product development, and audience engagement teams. So I'm really looking forward to working with all of you more closely in the years ahead. But yeah, the idea, overall vision here is to turn the center into a place to define, teach, and share best practices for communicating credible health information to, as we heard before, an increasingly fragmented world, right? It's not just about putting out a press release, could not agree more with that statement. And yeah, hoping to build some new tools and mechanisms, capacity building across the school to help all of you do that work. So if you have any ideas for what you'd like to see out of CHC, or you're really passionate about this area, I'd really love to talk to you in the coming weeks. I'll drop my information in the chat, but thanks so much. And I'm looking forward to coming back to this group and talking more about what's planned, in due time. But lovely to meet all of you.
Thanks, Amanda. So now we want to get a better pulse of kind of what you all are thinking about with respect to community engagement, and also kind of some information about what you would like for us to know about as far as growth areas. Within our department, we have 2 community engagement cores. Those all, as Gary has already mentioned, serve as resources. Our P30 Center, which is sponsoring this event today, along with our P42 Center, which is our super fun research center, also has a community engagement core. And so we would like to see if we have a poll for you all. So Eileen, I don't know if you can put that up for us, if folks can fill this out. It just gives us a pulse of, what's happening among our department and center members here. And then lastly, there is a Jamboard that we'd like for you as we're going through our moderated Q&A. If you can take a moment to complete that, it's the link to it is in the chat. For those of you who may not know what a Jamboard is or be familiar with it, you will see once you open up that link, an opportunity for you to click a little Post-it figure. If you click that and drag it over to the whiteboard space, you'll be able to type in your answer. There are 2 questions that we're asking of you. One is, if you had unlimited time and resources, what would be your big idea or question to do community engaged research? And then the other is, what types of community partners would you be interested in working with? And this really allows us to start designing and building out resources that will help inform our part 3 of this series. So if you could take the time out to do that. But I would like to, I guess, take a moment do we want to look at the poll first before? Yeah, okay. So I don't know if everybody can see this, it's back up on my screen. So just, are you currently doing community engaged research? It's really great to see that some of you are, and that others aren't, but have either done it in the past or are really interested in doing it in the future. And I think that's terrific to hear. I mean, of course, you're here, so that's it's probably some indication. And we hope that this has, in addition to the other sessions that we're hosting, has been informative and really amazing information that has been shared by our speakers so far. So I wanted to just jump in and get us started with the ending of this, which is really around Q&A. And this is like a question I'd like to ask all speakers, because I think you all hit on this point. And I know that as researchers, we get really hesitant to engage and do community based and community engaged research. And in many ways, it's because of all of the things that we know can go wrong. So my question is, what are common pitfalls you see encountering as, folks may try to get started in this area? And I would also like to flip that question on its head, which is, how might we mitigate that? Like, how might there be a way to ease that? So kind of what are some of the common pitfalls, and what are, maybe one or two, and then maybe what are one or two of the ways that that's been mitigated in some way, shape, or form. So that's open to any of our speakers so far.
I can start, I guess. So I think the two sides of the same coin that I'd start with is kind of the jump to kind of making assumptions when you don't really know your key partners. So kind of that piece that Rashawn was talking about in terms of, asking for that letter and, making reasonable requests and things like that. And I think the solution is building strong partnerships, whether that's with 2 people or 25 people, but just starting small with 1 or 2 people that you think are really grounded in a related practice-based, work to the research you do, that might not be related to your current research now, but probably will be related to your program of research long-term, and building and cultivating that relationship and not making it all every time you interact with them about a transactional, will you do this for me for my grant? I think that's one of the easiest things you can do to build that relationship and build that trust. And I think it's also enjoyable for many of us. And if that type of work, which is hopefully doesn't feel like work, which is connecting with people, inviting them to your meetings, attending their meetings, sponsoring a table at their events, whatever that might be, that type of work, once the grant opportunity comes up that you want to actually write and engage in that research, then it becomes much more smooth because you're not trying to navigate the relationship from the very beginning. You already have that trust. And I think that's the hardest part. And you can make mistakes when you've built trust. You can't make mistakes when, no, this person is just meeting you for the first time, or you've had a very transactional relationship. So that's what I'd say.
Yeah, I would add, I think people underestimate how complex working with communities can be. And I think the default is to, try to get whatever project or whatever research that you're working with, trying to make it fit your mental model of what research looks like and what community engaged research should be, versus willing to take a step back and learn different approaches to approaching your research, really questioning, how your paradigm, kind of frames your understanding of research and contributes to the research questions you ask, how you frame things, and really taking a step back to listen to other ways and other sources of knowledge and trying to, have the two meet instead of trying to have things fit into your box. Yeah, super complex.
And I also just want folks to know that if you have questions, please do feel free to unmute or put things in the chat. I think if not, we have a few more questions, but do feel free to go ahead and raise your hand, unmute, and put your question in the chat. Jamie, do you want to ask the next question while people are?
So again, I think this, you've all touched on this really nicely, but I think maybe just to sort of thread the needles together, what resources, strategies, do you really think are available to better align, so to kind of work on this alignment between community needs and these academic and research goals? I think you've all touched on it a little bit, but I think it'd be nice to sort of kind of hear crosstalk of how, where do you really think the places are that people need to be working on to get that alignment? I think besides just having conversations, which I think is definitely, I think you've highlighted as sort of a key thing. Like, don't just jump in with the, here's my goal, can you align with me?
I'm bad with silence. I'll go again. Um, I mean, it depends on your research project, but I am always struck to Rashawn's example that he gave earlier about attending that research meeting and finding out that all these researchers like really didn't know Boston and they got this money to do this Boston-based project. It is not hard to read community health needs assessment reports that are freely available that are, you know, our hospitals and our health departments are required to do every year. That doesn't give you everything, but it is a nice place to start to say, I want to work in this community, and they've already done all this work to say, these are the needs that, you know, have been expressed here. I feel like I teach about community health assessments in my course, and most students have never heard of them before until they take my class, and they are mandated by, if you're an accredited health department and if you're a hospital that gets federal money, you have to do these community health assessments. And environmental health type issues are in many of them. And you can look at the Boston one, and there's a lot of nuance in there. So just knowing what people have already spent, you know, 2 years looking at secondary data, doing focus groups, interviews in their community, it's not everything, but it's a nice snapshot to at least go in and know, like, this is what this community has said. So if you're doing something that's very place-based, I think that's a really good start. Yeah, I'll just leave it there.
Yeah, and not to get too philosophical, and this probably doesn't even answer your question, but I think we have a tendency to have this, like we do focus on needs, but what follows that is this deficit framing of communities' issues. And we look at how can we help alleviate this problem, and we're not always intentional, or seldom are we intentional about, you know, what are the assets of this community, and how, what are the desires of this community, and how can our research support that desire? So even that simple flipping of, you know, what are their needs versus what are their desires, I think it just really changes the dynamics of the relationship that you have with community partners, but also the potential of strengthening and doing better research, adopting that.
Sheila, go ahead.
Hi, I have a question for any of you. Sometimes, I think most of you mentioned this already, but sometimes there's a disconnect between an academic timeline, like with a grant, and a community timeline in terms of they need information now for a hearing, for a different type of advocacy related issue. Do you have any advice for navigating like those differences in timelines in those situations? And then also, if you are working on a grant and there are delays or issues that come up, do you have any advice for how to have those conversations in a way that is beneficial to the community and they feel like they're getting out of these relationships what they need to be getting out for their advocacy and all the work that they're doing?
Yeah, only we work on an academic calendar, right? and most of the world doesn't. But I think that's where transparency comes in, right? So when you're exploring these ideas with your community partner, explaining what the timeline is and why it is that way. And I think you do two things. One, you're being authentic and transparent, but you also give folks the option of continuing that relationship, right? So, you know, and sometimes these conversations aren't comfortable, right? So you may not have, you know, did your due diligence and talked about this in a timely manner, and you're asking for like a substantial commitment in a week. But if you're honest about that, you know, folks at least have that choice to opt in, right? And say, you know what, I'm making an informed decision. I think the common mistake is to act like our timeline dictates everybody else's timeline. And we know that's not true, but you know, the pressures of our jobs, you know, our own capacity at times determine it, but also ask your partner what their timeline is too, because you know, things slow down in academia during the summer months, but for a lot of community organizations, that's their busiest time, right? And that's when things can happen, and they want to, hey, come out to this, and you know, folks on sabbatical, folks on, you know, took the month to go to the vineyard, and and folks like, you're not being responsive to me now, right? Like we have this partnership, but you're MIA, and then, you know, as August ends, now you want to begin things. And so, you know, really having those conversations on what it looks like for both of us, and trying to, you know, and I always think it's, you know, it's imperative that you have somebody on your team that is the liaison to that group, right? So it's not who's following up with, you know, XYZ organization. They know who that is. And so they could build that rapport, right? And if possible, having somebody on that community organization's end, which is always tricky because we always want to work with the executive director or the leader of initiative. They probably don't have the time. So you may be working with someone who's, you know, not really closely involved with the decision-making process of their organization, but that is your partner. And you know, and so it's kind of more art than science, I'd say, in dealing with that.
Yeah, I'll add to that. I was going to bring up team and transparency, so the very common themes, but you know, you mentioned the timeline of the partners and like things like testimony and things like that are like really rapid. On that side of transparency, I think it would be really important to be able to say upfront, like, these are the types of things I can do for you if I have a day. And these are the types of things that I could do for you if I had a week. And so it's transparency on the grant end, but also on that end. And just a quick note on transparency. In our coalition meetings, one of the things that we do is we have a 15-minute debrief at the end of each meeting to have people reflect on, well, how did that conversation with that researcher go? And like the number one thing that comes up as most frequent on the like surprising side for me is when people are like happy with the way the researcher said really clearly, I can't do that right now, but I'll think about how I might be able to do it later. They're like, oh, it's so honest. They didn't just promise they were going to do it. They like said no, but in the nicest way possible. Wonderful. And so that is very well appreciated. And it's something they're talking about like all the time. They're like, I loved it when she just said no. And then it told us how, told us why, told us this data set doesn't have that variable. So I actually can't do it in this study. So not being afraid to very kindly and clearly say like why something can't work for you, like logistically or even in your own research. So that's been a recent learning for me.
And I would add one other thing, and temper our expectations too, right? So like when I love working with communities, but it can be frustrating, right? So depending on the organization or the coalition or the group of partners that you're working with, community or in you know, so we have these large nonprofits that, you know, are community-based organization full of people with their MPH, right? Their meetings probably are very similar to our culture, right? You know, the technical language is similar, you know, efficiency, you know, folks are coming prepared with agendas and everything else. A lot of times working with community partners, who knows what you're walking into, right? You might meet every 2 weeks and it's the same meeting, right? One person trickles in on time, somebody comes 15 minutes late. They don't continue the meeting. They go over everything that we talked about. They do introductions again, right? And so if you allocated 45 minutes and you're like, this is my agenda, I want to talk about, you know, this part on the grant process, I want to talk about, you know, next steps on data collection, you might have to sit through a 3-hour meeting, right? That, you know, doesn't feel like it's very useful, but it's so useful in the relationship development process, right? But sometimes like we're expecting, like, I'm super prepared. They need to meet my culture of running meetings. And folks are like, no, it doesn't work here, you know, interrupting to get food, right? Like, you know, everybody gives announcements. It's a different culture. And, you know, so I think sometimes if we temper our expectations about what those spaces look like, we'll feel a lot better and less frustrated.
Yeah, on that end, I definitely agree. And I've had that same experience with meetings. Like when you're there and you're doing other things and helping in other aspects that aren't even necessarily related to your own project, that's when you're really able to form meaningful relationships with folks and you're able to have like one-on-one conversations and you're still able to get everything done, but it's working with their timeline rather than what we're sometimes used to in academia. Thanks.
Any other questions? Susan, I don't know if you want to.
I mean, we could, there's a few more things that we thought of to try to get group engagement around some issues. And I think this one's tricky because I think it risks sounding paternalistic or patronizing, or I don't know what, but you know, when there's a disconnect between a researcher and a community partner around, say, environmental health literacy, or you could substitute any topic, what are appropriate strategies or good strategies for trying to address that? Or, you know, like how this is the part that sounds paternalistic to me. How much is there an opportunity for education, bidirectional education between the researcher and the community group in a way that's respectful and also acknowledges that people have different sources of information, different perspectives on information, which are not always wrong or right. But like, it seems like that's an important part of relationship building, but also having some shared fund of knowledge is also important. So how do you balance those things? Hopefully that makes sense.
That makes sense. I'll share that on the coalition, we spent the first 3 months doing capacity building before we did any study review. So we did that mostly at the beginning on like a research fundamentals, because there are some people who knew a good amount about research and study design and things like that. And there were a bunch of people who had never done anything in that space. So in the beginning, it was around that, but now it's become more when we had those genetic studies. I don't know genetics research. It's very challenging. So we realized we needed to do at least one day of like, okay, this is like genetics research 101 type of thing. So we build it into the system that we've developed, that like that's part of the expectation. They knew that like capacity building and training was going to be part of the work. And then speaking to your bidirectional piece, in our evaluation of the coalition, we ask them what they want to learn in an ongoing way. So when we don't have review, maybe, you know, we have a break in April and nobody's interested in doing review that month, we'll put in kind of a almost professional development idea, but it's something that the coalition now has told us they want to learn. So we came up with like the beginning stuff, but really having mechanisms to kind of ask feedback about what their priorities are for wanting to learn and not assuming what they would want to know. I think we had to do some level setting on the method stuff, but other than that, it should really be, oh, now they want to know about like security level of secondary data that Meredith Rosenthal had in her policy study. They were like, how do they keep that confidential data? And is that okay? And I'm like, I don't know, but I can figure out somebody who can teach you that. Just being open to their ideas about what they want to learn. And then if there is expertise in the group on that topic, which is often the case, but maybe from a less academic perspective, making sure that person can come forward. So we had somebody who had been kind of a community advocate for the All of Us study. And so we had her do a little bit on the genetics day. She didn't do the whole thing, but she co-facilitated, and as much as possible, lifting up their voices. So you can only do that with like a standing group of people, but it works quite well.
Go ahead, Michelle, sorry.
I would just like add on to Becca, like be intentional about having that space available for that bidirectional learning. So, you know, making sure that, because folks will nod in agreement with everything you're saying. And I'll speak for myself, in fear of not letting you know that I don't know what you're talking about. So I'm just, it makes sense. But providing spaces, you know, like, you know, is there any questions that you have, and being specific? Like, I know I covered a lot in inviting people to really have that level of comfort to ask those questions, but also do it in return, because as people are talking about, you know, the desires of their community, language is different as well. And so, you know, seeking their expertise and saying, I need some clarity as well. So you're really creating this dynamic, like we're both teaching each other, right? We're both co-learning. So that, you know, there's things you're talking about in areas of expertise that you have that I know very little about, that I need you to explain to me. And I think people are appreciative to that. it needs to be done tactfully, right?
Yeah.
But I think you know, it has to be intentional, an intentional part of what we do.
I think it looks like you have a question.
Yes, I actually have a question for Liz. Liz, this is about the content creators program, and Rashawn and Becca both mentioned the importance of paying, you know, community partners for their work. And in my mind, kind of the content creators are a form of community partners. So I'm wondering, have you guys had that discussion about compensating, say, the influencers that you partner with? And then if you do pursue that, is there kind of a moral consideration about, you know, when you start paying, say, journalists for their work, then that becomes kind of gray.
Yeah, yeah,
conversation.
yeah. We are not paying them in any way, and we're not asking them to do any like thing for us necessarily. You know, we'll share content with them. You know, we'll help flag events or invite them to participate in interviews, or you know, if they want to, or provide training in exchange of money. It hasn't been discussed. I mean, you know, I think that the idea behind it was sort of like the grist 50 fixers,
Right.
like naming like people to a list, and hopefully it creates opportunities for them too, because they get to then claim that they're on this list. And
Right.
so I wouldn't think of them as much as community partners in the way that you all are.
Great. Thank you, Liz.
I want to be mindful of the fact that people have been on Zoom for a while, and so also just, you know, I know that we're not right at 5, but also being mindful of our speakers' time. So you know, want to take a moment and pause and see if there are any further questions. We certainly have many more questions for you all. Literally, we have them written down, but at the same time, I do want to be respectful of like Zoom end of day. So any other questions, comments, thoughts that folks might have? All right.
And I think if you know, we close the Zoom and all of a sudden you're like, wait, I wish I had contact information for that person, just send an email to the center and we can make sure you get in touch with people. Thank you. Eileen's always right on it. So I think that, you know, that definitely, you know, there's a lot of resources that I talked about today, so we can definitely put you in touch, because I learned a lot, even though I helped put the agenda together.
You know, this is fantastic to meet everyone and learn about all the great work you're doing and the resources that are available. It's really inspiring.
Absolutely. And this is certainly, you know, we have an environmental justice student organization who's very, been doing a phenomenal job, and really, you know, our students are leading the way in so many ways to kind of get us to engage, work with communities, and so on. So I want to thank you all for your time. It has been amazingly informative, and we look forward to having the opportunity to work with you all in the future. So just, you know, thank you again, and please join us for part 3 to be determined and announced soon. We want to thank everyone for taking the time out to join us today, and we look forward to seeing you all at a future Spark event.
Thank you so much.
Thank you.